Hi guys, welcome back to our channel All Round Health Talk. So today I'm going to be finishing the HIV video, talking about the symptoms, the diagnosis and treatment and prevention of the HIV infection and AIDS disease. Now, when we talk about the symptoms of HIV on its own does not have specific symptoms attributed to it. It produces symptoms according to the infections that it leaves our body vulnerable to. Like what HIV does specifically is attack the immune system of the body, thereby causing us to be vulnerable to different infections that our bodies would normally fight against. So when someone has the HIV infection, that person would be susceptible to different infections. Now we have three main classifications of the HIV infection. The first is the acute stage. So generally in the acute stage, the person would start to develop flu-like symptoms, right? The person would have sores in the mouth, the person would have fever of no known cause, the person would have like respiratory infections, repetitive respiratory infections, symptoms that are not really specific. So at the acute stage, the HIV infection is usually misdiagnosed for just any other infection that anybody could normally present, but in this stage it's usually too early to tell that a person has the HIV infection. Now the next stage would be the latent stage, where a person would not develop any symptoms at all. So the person would give off the impression of being healthy, and the person could live on with this infection for years, even up to 20 years, depending on the individual. So the duration of this latent stage depends on the individual. It depends on how strong the immune system of this individual is. So that does not have a specific duration for the latent stage. It strictly depends on the individual. So the last stage of the HIV infection is actually chronic infection. This is the main stage that is referred to as the AIDS, which is the acquired immunodeficiency syndrome. So it's in this stage that we can wholly say that a person has AIDS, because the person starts to get all the opportunistic infections of this syndrome. Now, there are different manifestations that could happen during this stage. That's when the person's immune system has dropped to the point where it cannot bear to perform the minimum function of fighting the slightest infection that could affect an individual. In this stage, the person with this syndrome would also be susceptible to having cancers such as cervical cancers, the Kaposi sarcoma, the Burkitt's lymphoma, etc. So in this stage, the cancers, there are some rare cancers that on a normal day, if someone has a well-functioning immune system, this person would rarely contact these cancers. So because in this stage the immune system is too low, this individual starts getting these cancers. So these are the three main classifications of the HIV/AIDS infection. So the next would be diagnosis. How do we diagnose this infection? Usually we diagnose HIV infection by detecting the antigen. That's the P24 antigen. This antigen is specific to the HIV virus. So we usually detect this antigen in the blood in order to diagnose the HIV infection. We can also detect antibodies against this infection, because HIV infection is like any other infection. Once your body detects that there's an infection, it starts to produce antibodies to try to combat this infection. So when an individual gets the HIV infection, the body starts producing antibodies against this virus in order to fight against it. So the detection of this antibody in the blood usually helps to diagnose the HIV infection. And another diagnostic method we use is the PCR diagnostic methods. So these three methods are usually the main ways of diagnosing the HIV infection, and of course coupled with the history of symptoms that these patients must have presented over the years, that's how we diagnose the HIV infection. Now, the treatment. Unfortunately, HIV has no cure. The HIV infection has no cure right now. So what we do is we have drugs that are called the antiretroviral drugs that help to slow down the replication of this virus, kind of helping the person live a near normal life, right? So I wouldn't say normal life because, of course, living with the HIV infection, it changes you. So taking the drugs helps to give the impression of a near normal life, right? It helps to give the person a higher life expectancy. People go up to 20, 30 years living with HIV, and well, they are able to carry out their normal life functions if they are on treatment. Well, if they're not on treatment, of course, your life expectancy would reduce. And of course, it depends on, like I said, it depends on the individual and how strong the person's immune system is to be able to withstand this infection for a very long time. But yeah, there is no cure for HIV. So this is basically the treatment that we give to an individual living with the HIV infection. Now, it's also very important to point out that pregnant women too can also have HIV, and they have a tendency of transmitting this infection to their child. So during pregnancy, if a woman is diagnosed with the HIV infection, she is to immediately start the treatment with antiretroviral drugs in order to prevent the transmission from mother to child. And of course, she is not going to be able to give birth through the vaginal means. They would have to perform a C-section on her, and even after delivery she still has to continue taking this drug for life, and it's not advisable for her to breastfeed the baby because that can also be a means of transmitting the virus to the baby. So before, it was thought that women with HIV infections cannot bear children because of the risk of transferring this infection to the children, but in recent times, because of the antiretroviral treatment, it's actually possible for an infected mother to have a child. She would have to be really strict with her treatment. She would have to take her drugs regularly every day in order to prevent this transmission. So there is hope, right? So prevention, of course, the prevention is always the same for sexually transmitted diseases because HIV is also an example of a sexually transmitted disease. So the first prevention technique would be safe sex, practice safe sex, the use of condoms, right? We have lots of ways of preventing pregnancies, but the only way that helps to prevent pregnancy and the transmission of sexually transmitted infections is the usage of condom. So when you use a condom, you reduce your chances of getting HIV/AIDS, especially if you're living with an infected partner. Regular checkups is also very important. If you work in an environment or you live in an environment where you are exposed to a higher risk of getting this infection, it would help you to always go for regular checkups so you can know your HIV status, right? So that's very important when it comes to the prevention of HIV, the HIV infection. And well, no to discrimination. Discrimination of HIV positive patients is not ethical. It's not advisable for anyone. HIV positive people are individuals like you and me. So let's say no to discrimination and let's help them to live a good life with what they have. So that's all we have for you guys today on the HIV infection. I hope you guys have learned a lot, and I hope that this is very beneficial, not just to you but to those around you, your friends, your family. You can help by educating them too. So don't forget to go to our online page, Instagram page, at All Around Health Talk to get more info on this disease. Also, don't forget to like, subscribe, comment on our YouTube channel, All Around Health Talk also. So, and also share to others too, right? So let them know about this wonderful information that's spreading to you guys now. So until next time, bye.